Welcome into this segment of For the Children, and joining us today is Dr. Michael Ramsey, and we're talking about, I guess, what some of us would say are weird things that happen to kids.
Right. I thought that this would be a time when a truly For the Children segment, where some questions that kids ask me all the time about things that their body does or that they don't understand.
Okay, now, one that we talked about beforehand, earwax.
Right.
Tell us about that.
I have a lot of people be concerned about earwax. Earwax actually does have a purpose. It's there to help keep the ear canal protected against moisture. It balances the pH of the ear canal, and it even warms the air as it comes in contact with the ear. And so when you see earwax at the ear opening, all you have to do is wipe it away. The main problem that we see with earwax, there are people who do produce more than others, but the main problem that we see is when people really go after it with a Q-tip and mash it down inside the ear, they can cause an occlusion of that ear canal.
Okay. Interesting there. What are some more things that you had there?
You know, I get a lot of questions about mucus, and so mucus is something that your body makes naturally. You make about a quart of mucus every day, and so it's kind of disgusting. So when you think about when you're sick, that mucus production increases. Mucus is there to help sweep out things that aren't supposed to be in your nasal passages and in your gut. And so even when you're healthy, you're going to swallow about 2 cups of mucus every day with your saliva. And so the thing that I have a lot of people worry about is when their child is sick and they cough up mucus and they swallow it back. That's okay. It's not going back into the lungs. It's going to the stomach. The stomach acid takes care of it. Obviously, too much can irritate the stomach, but it's not necessarily a bad thing.
All right, now we'll move on from cups of mucus to what's next.
Yeah, another question I get asked is because babies tend to hiccup a lot. Hiccuping is a spasm of the diaphragm, that muscle that's there at the bottom of the chest that helps you breathe. And so when the stomach is full, either with food or with air, it can irritate the diaphragm and cause it to spasm. So that spasm goes down, it draws air very quickly into the voice box, and that makes that hiccuping noise. Babies do this a lot because their stomachs chronically stay full with gas from crying, and they eat a lot more often than we do. So it's not a big deal. You don't have to do anything. It tends to bother us a lot more than it bothers them. My favorite trick for getting rid of hiccups, a lot of people say hold your breath. What I usually recommend is letting your air out and then not breathing in and holding your breath that way. That allows the diaphragm a chance to relax, and it tends to get rid of them a little bit faster.
Okay, so there's 3 things that you really shouldn't worry about that some people do.
Right.
And I think we're about out of time. Have you got one real quick, maybe 15 seconds, another one?
You know, the other thing that we had kind of talked about was sneezing, which goes along with mucus. That's a way that the body just kind of scratches the inside of the nose. And so a sneeze can put particles up to 10 feet away, and they can stay in the air for about an hour. So if you have somebody who's sick in the room with you, that's how you can get it by not being right up next to them, is those particles can be aerosolized in the air for a long time.
Gotcha. Okay. Interesting segment today.
Well, thank you.
Very, very educational for all of us. And if you have any more questions for us on this segment For the Children, email us at morning@WTVY.com. And if you'd like to watch this interview again, check it out on the web channel, WTVY.com. You know, I know all that is natural